The upper limb. The upper limb consists of the pectoral girdle and the free part of the upper limb. Now, talking about the pectoral girdle. The pectoral girdle is located around the shoulder of a man. It is a set of bones in the appendicular skeleton which connects the arms on each side. This is the pectoral girdle here. It connects the arms on each side here. And the shoulder girdle is made up of two halves, which is the right half here and the left half here. And each half consists of two bones, which is the scapula, also known as the shoulder blade, and also then we have the clavicle, known as the collarbone. So this is the pectoral girdle. The scapula. The scapula, that is the shoulder blade, is a flat triangular shaped bone. You can see it here triangular shaped, and it is flat triangular shaped bone. The scapula has three borders. It has superior, medial, and lateral borders. This is another diagram of the scapula here. It has the superior, it has the medial, and it has the lateral border here. These are borders or margins. Borders or margins. So here is called, this is the medial border. It is called medial because of it faces towards the body. So medial border. Lateral because it is away from the body. This is the body here. So lateral border, lateral means it is away from the body. Medial means it is towards the body, and we have the superior body, and it's towards the body. And then this is the superior border. So lateral border, medial border, and superior border. And the scapula has three angles too: the superior, inferior, and lateral angles. This is the superior angle. This is the inferior angle, and then this we have here will be the lateral angle here. A lateral angle. This is the lateral angle here. The lateral angle of the scapula here. So the scapula has an anterior, that's frontal surface, and a posterior, that is a back surface. Anterior means frontal, posterior means back. So this is the posterior surface of the scapula, and this is the anterior surface of the scapula here. Over here in the diagram, we can see here the anterior surface, which faces anteriorly to the anterior here, forward, and the posterior surface is the one that is at the back. The posterior surface. So talk about what is present on the posterior surface of the scapula. We have the spine of the scapula. This is the posterior surface. This is the spine of the scapula. You can see here the posterior surface of the spine of the scapula. There is the acromion, which has an articular surface for articulating with the clavicle. This is the acromion here. And then its articular surface is here, which is articulate with the clavicle. And then we have the supraspinous fossa, is located above the spine of the scapula. This is the supraspinous fossa here, the supraspinous fossa above the spine of the scapula. And then we have the infraspinous fossa. It is located below the spine of the scapula. This is the infraspinous fossa, and this is the spine of the scapula. And then finally, there's what suprascapular notch is located on the superior border of the scapula. This is the superior border of the this is the superior border of the scapula, and this is the suprascapular notch. Now, talking about on the anterior surface of the scapula, glenoid cavity, which is the glenoid fossa, is articulated with the humerus to form the shoulder joints. So this is the glenoid cavity or glenoid fossa articulating with the word humerus. This is the humerus here. So it articulates with the humerus, specifically the head of the humerus, to form what? The shoulder joint. Here is referred to as the shoulder joint. The neck of the scapula. This is the neck of the scapula. The neck of the scapula here. There is the supraglenoid tubercle, which is located above the glenoid cavity. Supraglenoid tubercle here, located above the glenoid cavity. There is the infraglenoid tubercle, which is located below the glenoid cavity, which here is the infraglenoid tubercle, and supraglenoid tubercle, so located on the inferior part of the glenoid cavity. And then up next is the coracoid process. It protrudes above the glenoid cavity. Coracoid process, it protrudes above the glenoid cavity. Here is the coracoid process here. The coracoid process protrudes here. This is the coracoid process. And then finally, there is a subscapular fossa. It's located on the anterior surface of the scapula. So this is the subscapular fossa here. You can see it here, subscapular fossa. We can see the medial border here, lateral border here, superior border here, the superior angle, the suprascapular notch, the neck, and these are the components. This is the acromion here. The spine of the scapula is present here. The acromion is here, and this is the word clavicle articulating with the acromion. So this is the anterior surface of the scapula. The clavicle. The clavicle, also known as the collarbone, is located between the sternum, the breastbone, that is also known as the breastbone, and the acromion of the scapula. So this is the clavicle. This is the breastbone or sternum, the breastbone or sternum, and this is the word acromion here, the acromion of the words of the scapula, the acromion of the scapula. This is the clavicle here. It's an S-shaped bone, as you can see here, S-shaped bone with superior, that is the upper, and inferior, like lower surfaces. So it has two surfaces, a superior surface and an inferior surface. It has a superior surface here, and then the inferior is below. And it also has anterior and posterior borders. You can see here an anterior border here and a posterior border here. So it's a flat bone. Now, we have the body, that is the shaft of the clavicle. This is the body or shaft of the clavicle. There's a sternal end. It has an articular surface for articulating, articular surface for the sternum, and then there's an acromion end. It has an articular surface for the acromion of the scapula. So, articular surface here at the acromion end, articular surface here at the sternal end. We can see articular surface here at the sternal end articulate with the sternum, and articular surface here at the acromion end articulate with the acromion of the scapula. Now, the second part is the free part of the upper limb. The free part of the upper limb. The free part of the upper limb consists of three major parts. What are these three major parts? There is the arm. It comprises the humerus. There is there is the forearm. It comprises the radius and the ulna, and there is the hand, which comprises the carpal bones, the metacarpals, and the phalanges. So this is the what? This is the entire upper limb, where we have what, the pectoral girdle here and the free upper limb. So this is the free upper limb here, the free upper limb. Where it has three parts, which is the arm. In the arm there is the humerus. In the forearm there is the radius, and there is the ulna. And then in the hand, this is the hand here. There is the what? The carpal bones, the metacarpals, and the phalanges. This is the upper limb. Now, talking about the humerus is a long tubular bone of the arm, a long tubular bone of the arm. The humerus is tubular, as you can see. All these bones are tubular. Humerus is a tubular bone because it resembles a tube. Radius and ulna too are also tubular bones too. The scapula is a flat bone. The clavicle too is also a flat bone. Talking about the humerus now. So it's a long tubular bone of the arm. It consists of two epiphyses, that's proximal and distal, and a diaphysis, also known as the shaft of the body. So the humerus consists of two epiphyses. There's a proximal epiphysis here, proximal epiphysis, and a distal epiphysis. And then there is a diaphysis. Diaphysis is known as the shaft or the body of the humerus, the shaft here. This is about the humerus here. So epiphysis. So the proximal epiphysis, what is present? There is a head of the humerus where it articulates with the glenoid cavity of the scapula. This is the head of the humerus here. The head of the humerus articulating with the glenoid cavity or glenoid fossa of the scapula. The head of the humerus. The head of the humerus. There is the anatomical neck. It is located below the head of the humerus. It is located below the head of the humerus. This is the anatomical neck here. Anatomical neck is located below the head of the humerus. There is the surgical neck. Fractures of the humerus most commonly occur in this place. So here is the surgical neck here. It is here. The surgical neck is located below the tubercles. It's located below the tubercles. There is the greater and the lesser. The greater tubercle which resides laterally and the lesser tubercle which resides medially. The greater tubercle here laterally because of it's away from the body, and the lesser tubercle is medially, that is towards the body. And below these tubercles is the surgical neck, where fractures of the humerus mostly occur. There is the crest of the greater tubercle, which runs downward from the greater tubercle, and the crest of the lesser tubercle, which runs downward from the lesser tubercle. You can see here the crest of the greater tubercle, the crest of the greater tubercle, which runs downwards from the greater tubercle, and then the crest of the lesser tubercle. This is the crest here of the lesser tubercle here. And then there is the intertubercular groove, which is a groove that runs between the tubercles and their crests. This is the intertubercular groove here, all the way from runs between the greater and lesser tubercles and the crest of the greater tubercle and the crest of the lesser tubercle. So this is the intertubercular groove running here, intertubercular groove. And now we come to the what? Distal epiphysis, the distal epiphysis. So first of all, this is the body here. This point here is the body from here, or also known as the diaphysis, the body here to the body. Here is the what? Proximal epiphysis, which we just finished talking about. Here is the distal epiphysis. Here to proximal epiphysis. Here distal epiphysis. So here is the anterior surface of the humerus and the posterior surface of the humerus. The posterior surface of the humerus. You can see anterior posterior surfaces of the humerus. So posterior surface, which is the back, that is the back of the humerus, is the front or anterior surface of the humerus. Now, the distal epiphysis, condyle of humerus. It has the trochlea, which resides medially and articulates with the ulna, and the capitulum, which resides laterally and articulates with the radius. So over here is the condyle of the humerus. We have the word trochlea and the capitulum. Here too, the capitulum is here. Yes, it's a trochlea. So what is the function of the condyle? We can see here too. This is the trochlea, which resides medially, that's towards the body, and the capitulum, which resides laterally. The capitulum articulates with the radius, and the trochlea articulates with the ulna. Medial epicondyle is located above the condyle on the medial side, and the lateral epicondyle is located above the condyle on the lateral side. This is the medial epicondyle and the lateral epicondyle. This is the condyle of the humerus. This is the medial epicondyle here of the humerus and the lateral epicondyle of the humerus. There is the olecranon fossa, which is located above the condyle posteriorly. This is the olecranon fossa. Olecranon fossa here. Olecranon fossa. Olecranon fossa, located above the condyle of the humerus in the posterior surface of the humerus here. Olecranon fossa, so it is located above the condyle posteriorly. This is the olecranon fossa. And then there is the coronoid fossa, which is located above the trochlea on the anterior surface of the humerus. This is the coronoid fossa, which is located above the trochlea on the anterior surface of the humerus. And then there is the radial fossa located above the capitulum on the anterior surface of the humerus. So this is the radial fossa. The coronoid fossa and the radial fossa here located above the capitulum on the anterior surface of the humerus. Now, the next bone is the radius. We are going to the bones of the forearm, which is first bone is the radius. The radius is a long tubular bone composed of a diaphysis, that is a shaft in the body, and two epiphyses, proximal and distal. In the forearm, the bone is situated laterally, that is on the side of the thumb. This is the radius here. It is located laterally. This is the lateral side on the side of the thumb. This is the radius here. It has what? Two epiphyses, a proximal epiphysis, a distal epiphysis. Proximal means this is proximal here, and then distal, far off distal, and then there's the diaphysis. Proximal epiphysis, distal epiphysis, and the diaphysis. So now, the proximal epiphysis structures are the head of the radius. It carries the following structures. The articular facets. It is located above. It articulates with the capitulum of the humerus to form part of the elbow joints. The head of the radius articulates with the radial fossa of the humerus when the elbow is flexed or bent. So this is the head of the radius. This is the radius here. This is the radius and ulna. So we have the radius bone here. This is the radius here, and this is the radius. So this is the head of the radius here. It has an articular facet on top, which articulates with the capitulum of the humerus, and then there is also the articular circumference here. This is the articular circumference. It's articulates with the radial notch. This is the radial notch of the ulna. This is the ulnar bone here. The ulnar bone, this is it. It carries a radial notch. So radial notch of the ulna. This articular circumference articulates with it. Articulates with it. And also when the elbow is fully flexed, or bent, the head will articulate with the coronoid fossa, with the radial fossa. It will articulate with the radial fossa. When the elbow is fully flexed, it articulates with the head of the radius will articulate with the radial fossa. This is the radial fossa. This is the radius. When the elbow is fully flexed, this head will articulate with this radial fossa. Neck of the radius is located below the head of the radius. This is the neck of the radius, and then the radial tuberosity is located below the neck of the on the anterior medial surface of the bone. This is the radial tuberosity. The diaphysis now, which is the shaft, the body of the radius. The radius has three borders: anterior, posterior, and interosseous borders. These are the borders. There is the anterior border of the radius here, the interosseous border, here, which is close to the interosseous membrane, and then there is the posterior border. This is the posterior border of the radius. The radius has three surfaces: anterior, between the interosseous and anterior borders; lateral surface, between the anterior and posterior borders; and posterior surface, between the posterior and interosseous borders. This is the anterior surface of the radius between the anterior border and interosseous border. This is the lateral surface of the radius between the posterior border here and the anterior border. Lateral surface is here. It is lateral surface because of lateral away. That is lateral away from the body. Lateral away from the body. So this is the lateral surface, and then the posterior surface. This is the posterior surface here between the interosseous border here, and the posterior border of the radius. This is the posterior surface. So three borders and three surfaces. Distal epiphysis. Now, the distal epiphysis of the radius, it has a carpal articular surface. It articulates with the carpal bones. This is the carpal articular surface here. It articulates with the carpal bones, which is the first bones of the hands, which we will talk about. There is a styloid process of the radius. This is the styloid process of the radius here. Styloid process of the radius. Styloid process of the radius here. And then there is the ulnar notch of the radius. It is located on the medial. So the styloid process of the radius is located on the lateral border of the distal epiphysis, and then there's the ulnar notch of the radius. The ulnar notch of the radius is located on the medial border of the distal epiphysis. It articulates with the ulna. This is the ulnar notch of the radius. It is over here. This is the radius. This is the radius here, and then this is the ulnar notch should be here. It will be a notch for the ulna, for the head of the ulna to attach to. It articulates with the ulna, the head of the ulna. We can zoom in to see it properly here. This is the carpal articular surface. This is the styloid process of the radius, and this is the ulnar notch of the radius here, the articulation with the head of the ulna. The next bone is the ulna. The ulna is a long tubular bone with a diaphysis, also known as the shaft of the body, and two epiphyses, the proximal and the distal epiphysis. In the forearm, it is located medially, that's on the side of the pinky, that is the small finger. This is This is the ulna, located on the medial side of the body. This is the medial part, so medial, located at the side of the pinky. This is the small finger here, the pinky small finger. You can see it is a tubular bone also, located in the forearm, and located in the forearm, and it has proximal epiphysis, distal epiphysis, and a diaphysis, also known as the body. Proximal epiphysis. What are the structures? Olecranon, a massive protrusion that is located above and behind. It articulates with the olecranon fossa of the humerus when the elbow is fully extended, that is straightened, when the elbow is fully extended or straightened. This is the ulna. This is the ulna here. This is the olecranon. This is the olecranon here. This is the olecranon. The olecranon. The olecranon is a massive protrusion above and behind, and this olecranon is articulate with the olecranon fossa of the humerus, olecranon fossa of the humerus here. This is the olecranon fossa located on the posterior surface of the humerus. Olecranon fossa is articulate with it when the elbow is fully extended or straightened, as we can see in this picture here. When the elbow is this is an extended elbow. When the elbow is extended or straightened, the olecranon, which is located at the back, would articulate with the olecranon fossa. So the olecranon will articulate with the olecranon fossa. As you can see over here, this is the ulna, this is the radius, this is the humerus. So the olecranon is available here. This is the olecranon here. This is the olecranon. This is the olecranon fossa. Olecranon of ulna. So when the elbow is fully extended or straightened, this is when the elbow is fully extended or straightened, the olecranon interacts with the olecranon fossa, articulate with the olecranon fossa. This is the coronoid fossa, and this is the radial fossa here. When the elbow is fully flexed, the um, head of the radius will articulate with the radial fossa, and the will articulate with the radial fossa. Now, the next is the coronoid process. It is located in front and below the olecranon. It articulates with the coronoid fossa of the humerus where the elbow is flexed, that is bent. When the elbow is flexed or bent, this is the coronoid process here, located anterior to the in front of the olecranon. This is the coronoid process here, the coronoid process. So this coronoid process, when the elbow is is fully flexed or bent, this coronoid process would articulate with the coronoid fossa present on the humerus here. This is the humerus. Meanwhile, the head of the radius will be articulating with the radial fossa. There is a trochlear notch. The trochlear notch. It is located between the olecranon and the coronoid process. It articulates with the trochlea of the humerus to form part of the elbow joints. This is the trochlear notch here. The trochlear notch. This is the trochlear notch. The trochlear notch. The trochlear notch. It articulates. This is the trochlear notch here. It articulates with the um, trochlea of the humerus here. This is the trochlear notch here, articulating with the trochlea of the humerus. The trochlea articulated with trochlear notch articulated with the trochlea of the humerus here, as part of the elbow joints. Ulnar tuberosity is located just below the coronoid process. Just below the coronoid process. This is the ulnar tuberosity. This is the ulnar tuberosity here, located just below the coronoid process. Then there is the radial notch of the ulna. It is located on the medial border of the proximal epiphysis. It articulates with the head of the radius. The radial notch of the ulna is located on the medial border of the proximal epiphysis, and it articulates with the head of the radius. So this is the radial notch of the ulna here. This is the ulna. This is the radial notch of the ulna. The radial notch of the ulna here. Radial notch of the ulna articulates with the head of the radius, specifically the articular circumference of the head of the radius. This is the radial notch of the ulna. Below here, we could see here the ulnar notch of the radius. Ulnar notch of the radius. That is for the ulna to articulate with the radius. But here it is radial notch of the ulna present on the ulnar bone so that the radius can articulate with the ulna. Diaphysis, that is the shaft. The ulna has three borders: anterior, posterior, and interosseous borders. This is the borders of the ulna. The ulna, we can see the interosseous border here, the anterior border here. We cannot see the posterior border of the ulna. But this is the interosseous border and the anterior border. Then the ulna has three surfaces: anterior between the interosseous and anterior borders, medial between the anterior and posterior borders, and posterior between the posterior and interosseous borders. This is the interosseous border, this is the anterior border, this is the anterior surface here, present between the interosseous border and anterior border. And then there is the medial border. It's between the anterior border and the posterior border. So the posterior border is going to be next, but um, the medial surface is going to be around here, so that we call it medial because it is facing towards the body. The medial. Um, this here is the medial surface. The medial surface here, facing towards the body, so medial surface. And then the posterior surface of the ulna will be at the back of the ulna, posteriorly. That is going to be the posterior surface of the ulna. Distal diaphysis. On the distal diaphysis, there is the head of the ulna. This is the head of the ulna, articular circumference. It articulates with the ulnar notch. This is the ulnar notch of the radial bone. This is radial bone, so ulnar notch of the radial bone. This is where the articular circumference of the ulna articulates with. And then there is a styloid process. This is the styloid process here, which is located on the medial side of the head of the ulna, the medial side. So this is the styloid process here. The styloid process. This is the head, which has a articular circumference, and there's also the styloid process, and then so this is the parts of the ulna, of the distal epiphysis of the ulna. The next topic is the bones of the hand. The next part is the bones of the hand. The bones of the hand are divided into three groups. So in summary, this is the radius here, and this is the ulna, radius and the ulna. So the bones of the hand. The bones of the hand are divided into three groups. There's the carpal bones, the metacarpals, and the phalanges. The carpal bones. The carpal bones are 8 small bones arranged in 2 rows, proximal and distal. These are the carpal bones here. So for the bones of the hand, these are the bones of the hand. There is the carpals here, there is the metacarpals, and there is the phalanges. The carpals, the metacarpals, and the phalanges, also known as the fingers. The phalanges form the fingers. So the carpal bones are 8 small bones arranged in 2 rows, proximal and distal. Starting from the thumb, the bones in each row as follows. So in the proximal, these are the carpal bones here, 8 bones. In the proximal row, there is the scaphoid, the lunate, the triquetrum, and the pisiform. Starting from the thumb, this part here is the thumb. This is the side of the thumb because you can see the radius here, so the side of the thumb. The scaphoid, the lunate, the triquetrum, and the pisiform bone. On the distal row, there is a trapezium. This is a trapezium here. The trapezoid. This is the trapezoid. The capitate. This is capitate bone. And the hamate. This is the hamate bone. So 8 bones in total. This is the proximal row. And this is the distal row. Starting from the thumb, we label them scaphoid, lunate, triquetrum, and pisiform. And in the distal row, starting from the area of the thumb area, there is a trapezium, trapezoid, capitates, and hamate. These are the 8 carpal bones. Now, the scaphoid and the lunate carpal bones articulate with the carpal articular surface of the radius to form the wrist joint. So this is the wrist joint here. This is the wrist joint. We can see the scaphoid and the lunate articulating with the radius here, carpal articular surface of the radius. This is the carpal articular surface. We can see the articulation with the scaphoid bone and articulation with the lunate bone. So these two bones are the bones of the are the two carpal bones that articulate with the radius to form the wrist joints. Next is the metacarpal bones. The metacarpals are 5 short tubular bones. Tubular bones, because of this is metacarpal bones, they are like they look like tubes. Each metacarpal has a base, a shaft, and a head. This is the base. These are metacarpal bones here. They have the base, the shafts, and the head. 5 metacarpal bones from 1 to 5. The shaft, and so the base articulates with the distal row of carpals. The shaft is the middle portion of the bone, and the head articulates with the base of the proximal phalanges. So this is the head, this is the base, articulates with the distal row of carpals, this distal row of carpal bones, distal row of carpal bones here. This is what the base articulates with. There is the shaft with the body, which is the middle portion, and the head. The head articulates with the basis of the proximal phalangeal bones, or proximal phalanges. This is the base of the proximal phalanges. So the head of metacarpal bones articulates with it, with the basis of the proximal phalanges. Now the phalangeal bones. Each finger, except the thumb, consists of 3 short tubular bones, which are called phalanges. There are the proximal, middle, and distal phalanges in each finger except the thumb. The thumb only contains 2 phalanges, proximal and distal. In total, there are 14 phalanges in a hand. So these are the phalanges. These are the phalanges here. You can see here the phalanges. There are 3 types of phalanges. There is the proximal, the middle, this is the middle phalanges, and the distal phalanges. The thumb only has 2 phalanges, which is proximal and distal. It has no middle phalanges. So in total, there are 14 phalanges: 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 14 phalanges. And the phalanges are tubular bones. They look like tubes also. Now, the proximal phalanges consist of the base, which articulates with the head of the metacarpals, the shaft, which is also known as the body, and the head, which articulates with the base of the middle phalanges, and it is the distal phalanx in the case of the thumb. So these are the proximal phalangeal bones or proximal phalanges. They have a base which articulates with the head, head, articulates with the head of the metacarpal bones. They have the body of the shafts, and they also have the heads too, which articulates with the basis of the middle phalangeal bones. The proximal phalanx or phalangeal bone of the thumb articulates, its head articulates with the base of the distal phalanx, unlike others where it articulates with the middle, where the head of the proximal is articulated with the base of the middle phalanges. The middle phalanges consist of the base, which articulates with the head of the proximal phalanges, the shaft, and the head, which articulates with the base of the distal phalanges. So these are the middle phalanges. A base, which articulates with the head of the proximal phalanges. There is the shaft, which is the middle portion, the body, and there is the head, which articulates with the basis of the distal phalanges. And then the distal phalanges consist of the base, which articulates with the head of the middle phalanges, the base articulating with the head of the middle phalanges. There is the shaft, which is the middle portion, and the head. This is the head, which is flat and ends with the tuberosity of the distal phalanx. This is tuberosity of the distal phalanx here. So it's important to know that this is the thumb here. This is the thumb. The thumb has only 2 phalangeal bones, proximal and distal. The index finger, the search is the second finger. The index finger has 3 phalangeal bones: the proximal, the middle, and distal phalangeal bones. And then there is the middle finger, which also has 3 phalangeal bones. The fourth finger too also has 3 phalangeal bones. And then there is the small finger, even the small finger too, the pinky, also has 3 phalangeal bones: proximal, middle, and distal phalangeal bones. So This ends the topic about the upper limb. Thank you.